Hello, welcome back to Informal Training Solutions. Today we shall be discussing the neurogenerative diseases or the Parkinsonism and Alzheimer's disease. Of course, these are conditions which are characterized by progressive and irreversible loss of neurons or structures from specific regions of the brain. Now, with Parkinsonism, this is a disorder that is defined by the loss of pigmented or dopaminergic neurons of the substantia nigra pacta, that region of the brain which contains these dopamine neurons. Now, the symptoms of Parkinsonism have involuntary and rhythmic movements of the hands, arms, legs, and jaws, bradykinesis or slowness or poverty of movement, what we call poverty of movement, muscle rigidity or stiffness of limbs, and impairment of postural balance. These people cannot stand for long. Now, which drugs are used in management of Parkinson's disease? We have levodopa and combined with carbidopa. Now, of course, levodopa crosses the blood-brain barrier and is metabolized by decarboxylation to dopamine. Remember, we are trying to increase the dopamine level in the substantia nigra pacta. Now, however, it is given with carbidopa, which is a dopa decarboxylase inhibitor and introduces the peripheral metabolism of levodopa to dopamine. Remember, dopamine cannot cross the blood-brain barrier. And if more of levodopa is metabolized peripherally, of course, less will reach the brain. Now, it's effective in all signs and symptoms of Parkinson's disease. Side effects, we have GI distress, cardiac arrhythmias, and postural hypotension. Now, the others which we have is the dopamine receptor agonist. We have pargolid. This agot derivative directly stimulates both dopa-1 and dopamine-1 and dopamine-2 receptors. Bromocriptine is dopamine receptor agonist. The other we have pramipexole. It has high affinity to dopamine 3 receptors used in mild Parkinson's disease, and also because we can also have ropinirole, dopamine receptor agonist, sometimes used the same as pramipexole. The others which can be used, we have monoamine oxidase inhibitors. Remember, we are trying to increase the amount of dopamine, and dopamine can be metabolized by monoamine oxidase enzyme. Seleglin, co-catechol or methyl enzyme. This enzyme also could be used in tracapone and telcapone. Now, we also use the anticholinergics. Remember, the patient is having rhythmic movements, and all these rhythmic movements could be controlled by using anticholinergics. Now, benzotropine and trihexyphenidyl. Because trihexyphenidyl is what you call Aten in the pharmacies. Now, of course, these are anticholinergic and reduce the characteristic tremor in Parkinson's disease by blocking the release of acetylcholine. The side effects are rare as they are well tolerated. Let me briefly explain Alzheimer's disease, because this is the most common form of dementia, and of course it is also due to neuro dysfunction and cell loss in medial temporal lobe. Now, drugs which are used, I may not go in details for them. We have donepezil, rivastigmine, galantamine, and others could be used in management of Alzheimer's disease. But remember, all these ones are neurogenerative disease. Now, this has been a short presentation on neurogenerative disease. Ensure you refer for more information, or you can always contact us. These are the other presentations which we have in the CNS. I always remain Wilson from Informal Training Solutions. Subscribe to my channel in case you haven't subscribed. Leave a comment, contact us. We shall always reply. These are WhatsApp numbers. The email is there. Informal Training Solutions Limited, Ltd, gmail.com. Thank you very much.